diras si tu vois. Ok, d'accord. Allez, à plus, bon voyage. All right, we've got one person checking us out live on YouTube. Very good, very good. Don't forget to like the video. Hey everyone, thank you for joining us. I'm Dr. Deigni. I'm a board certified plastic surgeon. I practice in Houston, Texas. And I do these Q&A sessions every Tuesday and Thursday, time permitting, usually starting around 7 p.m. Central Standard Time. A little bit late today. I was kind of working on a few things here, but glad to be live with you. So please go ahead and ask your questions. Like I said, I'm a board certified plastic surgeon. I practice in Houston, Texas. I specialize in body contouring procedures. So I do the mommy makeovers, body contouring with liposuction, lipo 360, BBL, fat transfer. I do breast surgery as well, breast cosmetic surgery. So breast lifts, breast reduction, breast augmentation, augmentation with implants, augmentation with fat transfer. I also do skin tightening procedures. I do the body lift, which is a combination of the hip lift and butt lift and the drainless tummy tuck. So plenty of procedures that I do to help contour your bodies and help you feel much better in your own body and increase and improve your quality of life. So thank you very much for your questions. I am streaming on 3 different platforms, TikTok, YouTube, and Instagram. So I definitely appreciate you guys following us, and please go ahead and like the video, share the video as well with your friends, and let them know that we are live and discussing these topics here. Jamie Brown, thank you for starting us up. How are you able to do a tummy tuck with 0 drains? Like, how does the fluid not build up like usual? Great, great question. That's the technique that I use. A very, very small amount of plastic surgeons here in the US actually use that technique. I think it's an amazing technique that actually allows you as a patient to recover a lot faster. The way I do it is when I close your tummy tuck. So I'm going to show you on this picture. Sorry, guys, I don't have these green screen opportunities on these platforms on YouTube or Instagram, so bear with me. On TikTok here, you can see where the before picture is, right? So with the tummy tuck, the incision goes from hip to hip, and that's the same incision that I do for the drainless tummy tuck technique. Where it changes in the first is when I actually close things up. So I put multiple sutures all around here, where originally during the traditional technique where they put drains in, all of that space is actually open. So the fluid will collect and you have to drain it out so it actually does not stay and create a pool of fluid. But when I do my technique, I close up the space so everything's actually nice and tight. Thank you, Michelle, for the gift. And that really minimizes the amount of fluid that pools, and your body's actually able to absorb it naturally and then take care of it without having any drains. That allows you to actually recover a lot faster because you're able to stand up straight within the first 3 days after surgery. The majority of my patients are standing up straight within the first 3 to 5 days. They are also able to wean off their pain meds within that same amount of time. They come to see me usually about 1 week after surgery, and they're walking upright. They're off their pain meds, and a good amount of them actually drive themselves to come to the appointment. So it's fantastic. Avian, I'd love to have a tummy tuck. How much does it cost? So please go ahead and contact us. We're in Houston, Texas. Our phone number is 281-724-3138. The price for the Drainless Tummy Tuck usually will start around $11,500, and that includes surgeon's fees, anesthesia fees, and facility fees. So it's all inclusive. When you have your consultation with us, we will give you a specific quote based on your treatment plan. And that quote will be good for about 6 months for you to be able to schedule your surgery during that time. Thank you guys, everybody, for participating. I appreciate it. Share the link with your friends. We had a wonderful session on Tuesday. We actually extended from, I usually do it for about an hour, and we extended to 2 hours because there were so many people actually participating and engaging and asking a lot of questions. We had some great content and great participation. So, all right, let's see here. The official G World's Girls. Any available appointment in March? Yes, we do have appointments available. So definitely give us a call or put in your information. That's the easiest also. Put in your information on the bottom left of the screen. There should be a form where you can put your name, phone number, email, and then a brief message as to which procedures you're wanting to have done. And then we will reach out to you and guide you through the process and book your appointments. We've had some wonderful consultations even today, and they were able to actually get on the schedule for the end of the month and also for March. So definitely come and see us, and we will be happy to take care of you. If I missed any of your comments tonight, please, I apologize, but please go ahead and continue to post them so I can see them. I am definitely flying solo on this, and I'm trying to do my best to get to everybody's comments, okay? Again, how bad is the scarring after surgery, and how long does it take to heal? Okay, so the scarring is hidden well underneath the bikini line and the underwear. And so the majority of my patients will heal with a really thin scar. And you can scroll through the TikTok content and my Instagram content as well for you guys on Instagram. On YouTube, I have a little bit of before and after pictures available, but definitely also on my website, which is DeigniPlasticSurgery.com. Go through it and you'll be able to see how thin the scars are. Of course, everybody heals differently, but the majority of my patients will have very nice thin scars and are very happy with them. Gladys Guzman is asking, how long after weight loss surgery can we get the tummy tuck? Great question. Typically after weight loss surgery, it'll take you about 9 months to a year to lose the weight and stabilize your weight, and then we can move forward with the tummy tuck. So usually give yourself at least 9 months after your weight loss surgery, and then come in for your consultation, and we'll be able to see where you are in your transformation journey, and then we'll be happy to get you on the books if everything is looking good and doing well, okay? Adam Martinez is asking how much. Again, for specific pricing, definitely please contact us. Put in your information at the bottom left of the screen. We will reach out to you. But the starting price for the Drainless Tummy Tuck technique is $11,500, and that includes anesthesia fees, facility fees, and surgeon's fees. And also part of the Drainless Tummy Tuck, I inject I fix the separation of muscles, but I also inject your belly with Exparel. Exparel medication is medication that slowly releases pain relief medication for up to 3 days, which really decreases your need for pain pills, and it actually also decreases your pain level overall, which is fantastic. Breaking free from 715. Ever do plastics on someone who's lost over 460 pounds? I don't recall ever doing surgery on anybody who's lost that much. I think the most my patients have lost was probably around 200 or 250 pounds. So 460 pounds is significant. If you're wanting to have body contouring plastic surgery with us, by all means contact us. We'll be happy to take care of that. Breaking free from 715 pounds. Wow, that's amazing. Congratulations on your weight loss journey there. Okay, Gino Dalal is asking, can I do a flight tummy tuck without a tummy? Can I do a flight tummy without a tummy tuck. I'm not sure what a flight tummy is. Can you please elaborate? And I'll see what I can understand and answer your question. Very good, very good. Wonderful questions. Thank you guys for your patience. I know I'm the only one manning all of these, but I'll be happy to answer your comments. Please be patient. Michelle, booking my consult with you. Wonderful. Looking forward to taking care of you. I appreciate your support. Britt Bratt is asking, what is the BMI requirement? BMI requirement is 35 or less. So max BMI is 35. Let me give you a couple pointers on that. If you're 5 foot tall, max weight is 179 pounds. If you're 5'4", max weight is 204 pounds. If you're 5'8", the max weight will be 228 pounds. So that's kind of like a ballpark there. Hopefully that helps. User long number is asking, my poodle wants a mommy makeover. Can you do dogs? I am not a veterinarian. I don't operate on animals. Breaking free from 715 pounds. Ever do plastic? Okay, so I already answered that. Wonderful. Okay. Vicky Ayisu. All right, you've been following us and asking questions for quite some time. Very happy to see you back. Can you do only a tummy tuck and get a nice contour because I have a lot of fat in my love handles? So that's a good question. Some people will benefit from the combination of tummy tuck and liposuction. There are a lot of things that can happen here. Some patients may not have the budget to actually include multiple procedures, so they'll go with the procedure that addresses their specific need and desire and complaint. So, for example, as for you have a lot of excess skin and you have some separation of your muscles around your belly area. You've got some sagging of your mons pubis area, and your budget doesn't include being able to, have more than just one procedure. We will start with the Drainless Tummy Tuck. Now, if you want contouring, fat transfer, and a flat belly, and you're not able to afford it, you can come back and stage it. So we can do one procedure, stage it, you'll recover from that, and then also build up your finances and then come back for the next step. So that's definitely something that can be done. So for example, in the before and after pictures that you see here, my patient underwent a body lift, which is a skin excision procedure with a combination of the Drainless Tummy Tuck, hip lift, and the butt lift. There's no liposuction. There's no fat transfer. This is uniquely me cutting out skin and fat, redraping the body, bringing things up and contouring everything nicely so that she has a beautiful contour. So that can definitely be achieved as well. And it depends on what your baseline anatomy is like. So everybody's different in their anatomy and what they start off with. So we also have to understand that. All right, let's see here. Moving on to the next question. Do you see patients from other states? Absolutely. We have patients that fly in from all over the US or drive in. We also have patients coming from different countries, Canada, Mexico, even from Europe or sometimes from Africa. If you're able to travel to the US to have surgery in Houston, we will be happy to take care of you. Thanks for your question there. Hello, Angela Washington, 7465. Thank you for coming in and joining us tonight. Okay, so Genio Dalal was saying, can I do a flat tummy without a tummy tuck? So it depends on what you present with. So some patients may not necessarily need a tummy tuck, but can do liposuction and get a nice flat tummy. I have some pictures of that on my website on liposuction. I also have posted it in TikTok and on Instagram as well. So it all depends on what you present with. If you have a lot of excess fat and skin, you're not going to get a nice flat tummy, or at least the best results with just liposuction. For example, this patient here would never be able to achieve this level of flat belly with liposuction only. The actual skin excision surgery is what gives her a much nicer, tighter belly area. So, very good question. And this is something that that we decide and see when you come in for your consultation, because I can examine you and see what your tissues are like, what your skin is like, where the areas of fat accumulation are. Quickly is asking, can we use insurance? Unfortunately not. The majority of these procedures are not covered by insurance. And I don't take insurance. My patients pay out of pocket. We also offer 4 types of financing options. We have patient fi, cherry financing, care credit, and Alpheon. So please go ahead and give us a call. Come in for your consultation. We will definitely get you in for your consultation and for your surgeries. All right, so let's see here. Acting Up is asking, do you work with men? Yes, I do. I've operated on men. The majority of them will come in for some liposuction or lipo 360 or some ab etching. Sometimes even for the Drainless Tummy Tuck if they've had a lot of massive weight loss. I also operate on men. They will ask for some chest contouring. Some of them will have man boobs, which is gynecomastia. So I've operated on them to remove that as well and contour their chest and body a lot better. So definitely we work with men as well. So come in and see us, and we'll be happy to take care of you. Put in your information in the bottom left of the screen. This is on TikTok. For you guys on YouTube, contact us. Our phone number is 281-724-3138. Same for you guys on Instagram. All right. What is the highest BMI? Highest BMI is 35. So we want you to have a BMI that's less than that so we can move on. Your BMI is 42. That's a little too high. We'll have to get you to continue to lose some weight. If you've hit a plateau, it depends on where the excess weight is located. I've operated on patients who have had BMIs in the 40s, but it all depends on where you carry that weight and what type of surgery you might need to do. So for example, if the majority of the weight that you now have to lose is located in your thighs and legs, and you have flabby arms, you have deflated breast, we can go ahead and move forward with an arm lift and a breast lift surgery if that's your particular case. But again, it depends on what you present with, and we would have to see you in person so I can examine you and see what needs to be done. Wonderful questions. Okay, so everybody's asking questions related to the BMI. I'm sure probably people are popping in and out at different times. The BMI is 35 or less. So maximum BMI is 35. How is the recovery? Wonderful question there, Kim Bynum. So for my patients, like I said, the majority of them will be walking upright. So not hunched over using a cane or a walker. They'll be walking upright within the first 3 days after surgery. They typically wean off their pain meds within 3 to 5 days. They're off pain medication completely. And they typically will come to see me in the office about a week after surgery, and they're driving themselves. They're off their pain meds, and then they're going back to work as far as like being on a desk job. So the recovery is fairly quick and a lot smoother than if you have to deal with drains. So wonderful, wonderful. Let's see here. Okay, so I already answered that question. Okay, so good question by Gabriella M0324. If I weigh 200 pounds and I want to be at 150 or 160, thank you very much, Tanya, for the rose there. Do I have to lose weight or can you work? Okay, good question. So my recommendation is that you get to within 10 to 15 pounds of your goal weight. So if you're 200, you want to be around 160. I can operate on you if you're at 175 pounds. So you got about another 25 pounds to lose, and then we can go ahead and move forward with the procedure. The reason is, if I operate on you and you're at 200 pounds, and then over the next year or two, you're going to be losing 50 pounds, it's going to affect the results. And we definitely want you to have your results long term. The way it's going to affect the results, it depends on how much weight you lose, how things change, how your body reacts. And so you will probably need a revision surgery. For me, I mean, I would do an additional procedure, but overall, my goal is to be able to operate on you once and you're happy with it and you have a great experience. If you want to be operated on, multiple times, you can. But my recommendation is get to the weight goal that gets you at least 10 to 15 pounds to your ideal weight, and then we can move forward. So 5'4", the maximum weight would be 204 pounds. So definitely you want to be less than that, okay? That's Carrie Ann who posted that comment. So let me see here. LJ Luther is asking, do you perform brachioplasty? Yes, I do. I actually do perform that. That's arm lift. For those of you who don't know the medical term brachioplasty, it's an arm lift. I typically would do a combination of liposuction to the arm and then skin excision of that. So Walker Made 6. Hello, what's the downtime on the tummy tuck? So for the tummy tuck, again, it's 3 to 5 days for you to actually start walking upright. You're off your pain meds usually during that time. You're back to see me in the office a week after surgery. And you're typically off your medications, and then you're going back to work, desk job work. You still have some weight restrictions, weightlifting restrictions, up to about 6 weeks. You'll start walking immediately after surgery. You'll start doing some light aerobic activity, going to the treadmill, to the gym to do some treadmill, walk around your neighborhood within the first 2 to 3 weeks. And definitely by 6 weeks, you can get back to the gym and start doing some low resistance training. Okay, so Jake Queasy just asked about the drainless tummy tuck. We just answered that as well. Everybody's asking about that. It's fantastic. Joanne San Miguel is asking, what is a drainless tummy tuck? So it's a technique that I use where I do your tummy tuck, but I don't have to put drains in. I close up the whole space using meticulous suturing, my technique, and it closes everything up so that you're actually able to walk upright a lot faster than if you have drains. And it also makes your recovery a lot smoother. So definitely give us a call. Put in your information in the bottom left of the screen, and we'll be happy to take care of you. Miss Rich $signs. Can I do hip lift and liposuction only? It depends on what you present with. So there are different things that can be done for each patient. My goal as a plastic surgeon is to ask the questions to understand what you're trying to achieve. And then I present you with a treatment plan that will get you to that result. Now, not everybody can necessarily do all of those procedures that will lead you to that result. So based on your budget, based on your timing, some people need to recover a lot faster than others. They can't do like a 6-hour surgery. They need something that is not as long so that they can recover much faster, go back to it. Everybody has their own restrictions and own desires. So based on your specific desires, we will be able to come up with a treatment plan that's going to get you as close as possible to the results that you want. You're very welcome. I'm very happy to take care of you as well. Thank you that you find this information helpful. So you're in New York, but you can't do a consultation. What should I do? You can. So for all of our patients who are not in Houston, and who can't come in for their appointment, we start with a virtual consultation. So just contact us. You can call us, 281-724-3138, or put in your information in the bottom left of the screen. That's the easiest way. That way we can reach out to you, and we will guide you through the process to book your appointment. All right, Angela is asking about the aftercare. So the way I do these procedures is to make your aftercare be as easy as possible. So you don't need skilled nursing facilities. You don't need to go to a recovery room or house. If you fly in or drive in, I ask that you come with an adult to supervise you, at least for the first day or two after surgery as you recover. And then after that, usually you should be able to kind of start really taking care of yourself. And the recovery is quite straightforward. All right, so people are asking about pricing. Again, for the drainless tummy tuck, it starts at $11,500, and that's all inclusive. And for your specific surgery, once we do the consultation, either virtually or in person, we will be able to give you a specific quote for you. Ray content creator. How long after bariatric surgery should you wait to get a tummy tuck? So you should wait about 9 months usually will take about that long for you to start really seeing the weight loss and then maintaining that. So typically you'll probably have surgery at around a year after that, but you can start your consultation process probably around 9 months after your bariatric surgery. Tummy tuck BMI max is 35. Rosie Hernandez, what's the diet 1 month before surgery? So for me, I want you to be in a healthy lifestyle. So as long as you are at a healthy weight and a appropriate BMI, you can eat whatever you want. What I would definitely have you stop doing is any smoking. If you're smoking, you have to quit. And that's smoking cigarettes or smoking weed, marijuana, or things like that. And then we have to make sure that if you have any medical problems, that we optimize those so that we can move forward with surgery. All right. Queen Arisha, to you. Do you do awake tummy tucks? I do not. The only awake procedure that I would do with that is a mini tummy tuck. But that's a very, very select type of patient. I would say 99% of my patients are 99.99999. I've only done one mini tummy tuck with a patient awake. And like I said, it's very rare that somebody will qualify for a mini tummy tuck. But definitely these types of procedures, I do not do awake. It would not be safe. We need to put you asleep. It is a lot safer to get you asleep completely and get through the procedure well and then wake you up. Do you do lipo with J plasma? Yes. So I'll combine J plasma skin tightening procedures for my patients who undergo liposuction. If there is definitely some skin quality looseness, and I feel like you'll have a little bit too much looseness if we just do liposuction, we can actually combine it with J plasma, which is also called Renuvion. Great questions. Lowest BMI. Well, we want you to be in a healthy BMI. So lowest will probably be, I forgot what it is. Let me double check quickly if I can find what the BMI is. It would be somewhere in the 20s. So let me just find it very quickly. I typically go to Google. I just type a BMI calculator. So I would want you to be in a BMI of 18.5 will be the lowest BMI. Okay, so TikTok just gave me a live restricted for some audiences. Contains themes that some may find uncomfortable and has been restricted. Regulated goods content. I have no idea why TikTok is doing this. The notice I'm not sure why I got this restriction. They've been definitely cutting back on a lot, unfortunately, and putting up restrictions that have no merit, don't make any sense. The explanations they give are completely off the chart, I guess. Right now, I'm unable to answer direct messages for some community violation, and I have no idea what the community violation is. They say that we've been using some hashtags that don't even make any sense, that we've never used. I'm not sure if they're having glitches or problems. Anyways, I hope you guys are getting the content. I try to do this, like I said, every Tuesday and Thursday to bring some education. And I'm not sure why TikTok is censoring so much. I don't think they have any people, live people actually following the lives. Maybe it's their AI or computer programming, however they do their algorithm. Regardless, I'm here for you guys, and I'm happy to answer the questions. So let's see here. How much is the stainless? I think stainless is a typo. A lot of people, I think it's autocorrect. Drainless Tummy Tuck, it starts at $11,500. Contact us, put in your information in the bottom left of the screen. We will reach out to you and help you out with that. And let's see here. Okay, somebody is saying, Doctor, I got high definition lipo. I'm 2 months post-op, almost 3, and I'm still swollen from my stomach. Is that normal? I can't really answer that question. What I recommend is that you go see your surgeon who did the procedure on you, and definitely follow up with them. I think a physical examination will be warranted so that we can see if it's normal swelling or if it's a fluid collection or seroma that has developed. So definitely be in touch with your surgery team. Nurse Brown, 5'7". How much would I have to weigh? Should I be? Okay, so how much should I weigh? So for 5'7", your maximum weight will be 222 pounds. If you're less than that, you'll be at a BMI that's 35 or less, and we will be happy to have you come in so that we can take care of you. All right, so let's see here. 5'2". Sarah Ramirez is saying she's 5'2". So for 5'2", you want to be 191 pounds or lower. User 1903 is asking, is this covered by insurance? No, it is not. These procedures are paid out of pocket. They are considered to be cosmetic elective procedures, and all of our patients pay out of pocket. We offer financing options. So that would be patient fi, care credit, Alpheon, and Cherry financing. Hello, Amelia. Thank you for joining us. Do you have a question? Post it. How much does this cost? We've covered that. So let's see here. April 504 is asking, can you do a tummy tuck and a back lift at the same time? Yes, you can. And I've done it on some patients. So definitely if you have a lot of loose skin in your bra line area and you want to combine that with your tummy tuck, we can definitely do it during the same procedure. So put in your information in the bottom left of the screen there. We will be happy to get you in for your appointments. If you're out of Houston, out of town, out of the state, even of Texas, we will start with a virtual consultation. So for you guys on the other platforms here, our phone number is 281-724-3138. We will be happy to take care of you. Jasmine SUGC. Can you do a brachioplasty and a tummy tuck at the same time? Yes, you can. I've done that on some of my patients who've requested that for their mommy makeover, and I've posted it on TikTok. You can definitely go through the content, and you'll see when I talk about that surgery as well. Wonderful, wonderful, wonderful questions. Okay, great. Gail Fuqua is asking, can you get a tummy tuck after a C-section? Absolutely. I've operated on many, many, many patients who've had multiple C-sections. Some have had 2, 3, 4, even 5 C-sections. And I've been able to actually remove that C-section scar, give them a much softer and tighter belly with a new belly button looking really nice and very nice contours. And I also take care of the fupa area, so the mons pubis area. Sagging that happens around this level, I lift it up to make it nice and soft and better contoured for our patients. Very good. So what is the recovery time for a whole body lift? So for this patient, like I said, you will wean off your pain meds within the first 5 days of surgery. You're going to be walking upright within that same time. By the time you come back to see me in the office, usually about 1 week after surgery, you're walking upright, you're off your pain meds, you're sometimes even driving yourselves. Some of my patients will drive themselves. Some will come in with a friend who's driving them or their caregiver. You will be walking immediately after surgery, but you're going to start walking more like for exercise around 2 to 3 weeks, going to the gym, doing some light aerobic activity on the treadmill. And then you're going to be doing some light resistance training in the gym at around 6 weeks. So it's a fairly quick recovery without the drains, because I do all of this drainless with the technique that I have. I close everything up in multiple layers. It really reduces the risk of seroma and fluid collections, and then it actually gets you a lot better healing. So Lauren is asking, how is overall swelling with the drainless technique versus with drains? From seeing my patients and how they have been able to recover, I've noticed that the swelling is actually much less. The recovery time is cut down. They are able to recover a lot faster and a lot smoother. I've had some patients who've told me they went and had their surgery with me, while some friends had surgery with the traditional technique and drains. And after 2 or 3 weeks, they were still with their drains, still in pain, and also hunched over, while my patient was already upright, walking, going back to work, and not really having any issues. So it does accelerate your healing process. I would say about 2 to 3 weeks ahead of the game, which is fantastic. Okay, so let's see here. Pamo, great question. I was told that if you are on GLP med, it's not safe to put them under anesthesia. Is that correct? We stop the medications, the GLP-1 medications, 3 to 4 weeks before surgery. The reason is because the medications slow down your the emptying of your stomach, and if we put you under general anesthesia, you get you have a potential and risk of aspiration. Means that you can inhale gastric contents. So if you throw up, for example, during surgery or something, or when you're getting extubated and stuff like that, and you breathe in, of course, you're not completely awake when you're kind of transitioning from general anesthesia to being awake. You can inadvertently aspirate, and that's what we're trying to avoid. So we stop the medications usually 3 to 4 weeks before surgery, and you do fine. I've operated on patients who are on GLP-1 medications. That's the protocol we use, and they've done extremely well. So if you don't do it that way, yes, it does put it does put you at some risk. But there are other tricks that we do. So, for example, I mean, of course, this is not emergency surgery. Emergency surgeries and traumas, we definitely use many other tricks, and we have to do the surgery. But these are all elective procedures. There are things that we can do also. If you say, for example, you took it 2 weeks ago, there are things that we can do. We can give you some medication to empty out your stomach and really reduce the risk of aspiration as well. Scrabble up 916. What are the signing process? Okay, so for the Drainless Tummy Tuck, it starts at $11,500, and then we are going to tailor it to your specific needs based on your physical examination when you come in for your procedure. Or sorry, when you come in for your consultation and your appointments. All right, let's see here. Question by Honey. How does this procedure affect the lymphatic system? So great question. When you do the tummy tuck, you make an incision. I make an incision from hip to hip. So it disrupts the lymphatic channels that are in this area. It takes time for those lymphatic channels to reconnect and reestablish to be able to drain that. And that is something that also contributes to the increased swelling, the healing time, and things like that. But it really heals extremely well. And like I said, the majority of my patients are back at work usually within the first week after surgery for a desk job. They're getting back to the gym around 2 to 3 weeks doing aerobic activity, so walking on the treadmill, things like that. And then usually around 6 weeks, so just a month and a half after surgery, they're back in the gym doing light resistance training. Miss Cat is asking, do you have payment plans? Yes, we do. We have 4 financing options that we offer. It's the Care Credit, Patient Fi, Cherry Financing, and Alpheon. So those are the 4 financing that we do. Payment plans, if you want to pay by cash or money order or cashier's check, you can definitely make some deposits regularly throughout until your preoperative visits. So the amount will be paid in full before we move forward with surgery. Dark One is saying, I need this. We'll be happy to take care of you. Put in your information in the bottom left of the screen. Share the link with your friends. Let them know that we are live taking questions about plastic surgery. And I'll be happy to take care of you guys. It's always nice to be able to meet you in person and put a face to the username. Maricel Corona 67. What if you are diabetic? I've lost weight. I'm at 145 pounds. Stayed at that weight for 6 years. How much? Okay, good. So I've operated on patients who are type 2 diabetics. As long as your hemoglobin A1C is 7 or less, we're able to move forward with surgery. So 145 pounds, it depends on what your height is. If you're anywhere higher than 5 foot tall, you're fine. We can move forward with surgery as long as you don't have any other medical problems that need to be addressed. We're good to go. So definitely give us a call. This is our phone number, 281-724-3138. We are in Houston, Texas, and we'll be happy to take care of you. For those of you on the TikTok platform, please go ahead and put your information in the bottom left of the screen. There should be a form that you can fill out, and we will be reaching out to you to guide you through the process. Okay, good question by Soft and Central Me. Is it a good idea to do a tummy tuck and a BBL at the same time? It depends on your personal preferences. Some patients want to have everything done at once so that they have one recovery time. Like I said, everybody has different desires, and some patients want to actually separate them. So it all is based on your desire. If you want to do it at the same time, you will be recovering on your back for the first couple of days. Then once you're really nice and walking upright, then you can flip over and start sleeping on your belly. The reason we want you to avoid putting pressure on the areas where we did the fat grafting side is because it takes about 3 to 4 weeks for the fat cells that were transferred to get accommodated to their new habitat and actually start developing the blood supply to be able to survive. If you put too much pressure on it, it will decrease the amount of fat cells that actually survive. Okay, great question. Let's see here. Lino the lender. I had a tummy tuck, but it was botched with a front fat pocket. Is another tummy tuck required, or can lipo work? It depends on what it looks like. I'd have to see you and examine you so I can palpate the skin, see how much laxity there is, what needs to be done exactly. It could be that you need liposuction only, or it could be that you actually need a revision of that tummy tuck. So we would have to see you in person. Okay, so TT is saying, what's lipo 360? What's the difference between that and the normal lipo, please? Lipo 360 is the normal liposuction. 360 means you're going 360 degrees around the midsection. So it's liposuction 360 degrees. That's what we mean when we use that term. But it's normal liposuction. There's nothing different than the other liposuction. It's just indicating that we're going around your midsection. So it includes your abdomen, your love handles, your back, and your bra line. So all of this area. All right, let's see here. I need a mommy makeover, NG's World. 5'2", 180 pounds, and with a mommy pouch. Okay, you would qualify for a BMI that's less than 35. So we would be happy to have you come in to see us, and we'll be happy to take care of you. Come in, let's do the consultation. We'll decide what we need to do based on your goals of your mommy makeover, and we'll be happy to take care of that for you. All right, Joanne, I'm glad you're on live. Wonderful, wonderful, wonderful. Good, good, good. Thank you guys for joining us. I really appreciate it. Like I said, I do my best to answer all questions. If I miss your question, please repost Brown Bombshell 89. Please answer my question. I did not see it. Let me see. Please answer my question. Please repost it so it pops back up. We get a lot of questions and it keeps kind of scrolling up. So just repost it and hopefully I'll see it this time. Let's see here. How long the recovery? We answered that. So, okay, good question. Everyday Happy 4321 is asking, will this take care of cellulite? It does. So, for example, for my patient who has some cellulite around these areas, by lifting this up, it actually helps to remove and improve that cellulite. There are other treatments that we actually do for specific types of cellulite where it's located, but definitely anything that's located in this area will typically get much improvement from the body lift procedure. Tatiana is asking, do you do reverse tummy tucks? I've done reverse tummy tucks mostly in training, but not typically in practice. In my practice, I haven't had any patients who needed a reverse tummy tuck. And that's when you actually put the incision up around the breasts and you actually pull up. Instead of the tummy tuck, we go down. With the reverse tummy tuck, you go up. That's a lot. I'm not sure. Oh, probably, are you referring? I'm not sure what you're referring to. Maybe the pricing. I don't think it is at all. It's actually very well priced, but I'm not sure if you're talking about the number of surgeries or pricing. But definitely, we are happy to accommodate you for your surgeries. It's officially capped. How many deaths? How many deaths? What have I had? None. Thank God. These procedures are safe. Again, it all depends on good patient selection. If patients are sick, they have uncontrolled medical conditions, you are putting yourself at high risk to actually undergo these procedures. So you want to make sure that you go to a surgeon who is a board certified plastic surgeon is what I recommend. Plastic surgeon that's board certified by the American Board of Plastic Surgery. So go to abplasticsurgery.org. It is public knowledge. It's open to the public. Go to that website. There is a link that says, is my surgeon board certified? Click on it. Put in the name of the surgeon that you're wanting to have surgery with. If their name doesn't pop up, make sure you spelled it correctly. If you have and their name doesn't pop up, then they're not a board certified plastic surgeon. I would recommend that you find a different one that is board certified. Okay, Brooklyn Strong, inner thighs, jaw lift, and triceps. So those are completely different procedures there. It depends on what needs to be done. I'm not sure what exactly you want to do, but definitely we do thigh lifts. Jaw lift, like a lower face lift, that can be done as well. Depends on what you present with. Triceps, I'm not sure what you mean about triceps. Maybe if you have excess fat, we can do some liposuction and some Renuvion skin tightening to try to define it better. It all depends on what you present with. So definitely go and follow up with your plastic surgeon, or sorry, not follow up, but schedule a consultation with your plastic surgeon and see what needs to be done. Pretty Girl C had 5 C-sections. Is it safe to get a tummy tuck? You can, yes. I've operated on patients who've had 5 C-sections before. I've had patients who've had a combination of the vertical C-section scars. I've had them that had, the horizontal and the vertical C-section scars. They've had both of them. So I go ahead and remove all of them and pull that skin down and remove the C-section scars. So it takes a little bit longer because you have to be sure that you're in the right plane and you're meticulous and you take care of that dissection so that you're able to remove all of that and make it pretty for the patient. Ash is saying, I've had 4 C-sections, gallbladder removal, and a hysterectomy. Would a tummy tuck still be safe? Yes, I've operated on patients who've had everything that you have mentioned, plus even more stuff. So yes, as long as your medical problems, if you have any, are appropriately managed, we can go ahead and move forward with surgery. So definitely give us a call, put in your information in the bottom left of your screen. We will be happy to start with a virtual consultation if you're not in Houston or not able to come to Houston for an in-person consultation. And then once we get to your preoperative visit, we will have you come in person so I can meet you, we can meet, and I can actually examine you. All right, let's see here. Okay, Danny Momiana is saying, I have to get a hysterectomy. Could you do it at the same time? We typically don't do it at the same time. Main reason is because a hysterectomy is not considered a clean surgery, because you do have to go inside the belly area. A tummy tuck, you stay outside of the belly. You're just on the skin and the fat, and you're above the muscles. Where for a hysterectomy, you have to go inside. Now, it depends on how you get your hysterectomy done. You could do it at the same time if you have a team that coordinates, but it depends on how you get your hysterectomy done. That it really depends on how that is done. I wouldn't do it at the same time. I would have you get your hysterectomy, heal from that, and then you come back and I can do your tummy tuck. That would be my recommendation. Okay, so Ash is saying I'm 5'4", 190 pounds. Yes, you would qualify for surgery for me as long as you don't have any other medical problems. That will put you at a BMI that's less than 35, and my BMI cutoff is 35. Can scar tissue from a previous C-section be removed during a tummy tuck? Great question, my Penny. Yes, I do that all the time. For my drainless tummy tuck technique, I always remove the previous C-section scars. And typically they'll be placed a little bit high, usually above the pubic hairline. I actually cut that out and then I put my scar much lower. So that when you're wearing underwear or a bikini, your scar is actually nice and low and we can't see it. But I do remove that C-section scar as well. And that's outside as well as inside underneath your skin and fat area there. Great questions. Wonderful. Okay, so Maricel Corona 67 says, I want a mommy makeover, but I have a mommy pouch. I'm a diabetic, but I've been in control for 6 years. Good. As long as your hemoglobin A1C, like I said, is 7 or less, and you don't have any other medical problems, we'll be happy to take care of you. I've operated on patients who've had, who've wanted to get their mommy makeovers, who've had their blood sugars under control, and I've taken care of them. They've done extremely well. I've also had patients who've come in and their blood sugars were not under control. The hemoglobin A1C was much higher. It was like 9, somewhere even at 12. So once we got that under control, of course, we refer you back to your endocrinologist or your PCP who's managing your diabetes. We bring that hemoglobin A1C to a safer level, 7 or less, and then we move forward with surgery. Yeah, absolutely. So people are again asking about the pricing for tummy tuck. I think you're probably coming in much later. We've answered it multiple times throughout the live. The pricing starts at $11,500, and it includes anesthesia fee, surgeon's fee, and facility fees. So definitely give us a call, contact us, and we'll be happy to take care of you. Let's see here. Okay. Okay, TT is asking, do you do flex sculpt, and how much is that? I don't know what flex sculpt is. No, I don't do that. Candy Pants, can you talk about lipo with J plasma if you can do it? Yes, you can do it. So for my patients who have some excess fat pockets that bother them, they want liposuction. But when I examine them, I can tell that their skin quality is not the best. It's not going to snap back. So if we do liposuction and remove that fat, there's going to be some loose skin that they may not be pleased with. But it's not so loose that we have to actually put scars and do like a broad line lift or some type of surgical skin excision. We can use J-plasma, which is the skin tightening procedure. I would do that for my patients who I feel will highly benefit from it so that they're not left with a lot of saggy skin and they can actually have the nice results from the liposuction and the combination with the skin tightening procedure. For pricing for other procedures, please go ahead and contact us. Put in your information in the bottom left of the screen there or call us at 281-724-3138 and we will be happy to take care of you. Thank you very much for joining us. Candid with Claire Devaris. Much appreciated. Ask your questions if you have any. Let's see here. Okay, so College is saying, I'm debating on tummy tuck or lipo 360 first. My recommendation is to do the tummy tuck first and then come back and get your lipo 360 if you're going to be separating those two procedures. The reasoning behind, other surgeons may do the reverse. You just have to understand what the reasoning is behind it and be able to be comfortable with that. For me, when you do lipo 360, you remove the fat, right? Everywhere. And so you'll do lipo 360 around the belly area, the love handles, the back, the bra line, and all that stuff. As you heal, there's scar tissue that's going to develop because you went ahead and used this cannula to remove all that fat. Scar tissue develops. Now, when you come back for your tummy tuck after that, it's a lot harder to pull that excess skin all the way down here, which may leave you with some scarring up above. So if I had to choose, and you're going to separate those two, I would start with the tummy tuck and then come back with the lipo 360. That's my recommendation. But definitely go and consult with a board-certified plastic surgeon, anybody that you are wanting to do your surgery, and then ask them for their recommendations and why they would recommend that so that you're comfortable with that. You're very welcome, Kenny Pants. Thanks for your question. Good evening, Kaya. Thank you for joining us. Ask any questions you have. If I missed your questions, I definitely apologize, and please repost so I can get to it. There are a lot of questions, and I'm doing my best to field them and be able to actually answer them and pin them. Chassis P70, I really want the fat in my back out, but the inner part as well. Is that possible? I'm not sure what you mean about the inner part of the back. So you'll have to explain that a little bit more. Give us a call so we can talk in greater detail. Put in your information in the bottom left of the screen. We'll reach out to you and then get a little bit more information as to what you mean by that. But it seems like you will be able to benefit from some liposuction. But if you have a lot of back rolls, a lot of loose skin, then what I would recommend is a bra line lift, depending on where your excess rolls are. Okay, Caitlin Ann is asking, what is the cutoff weight limit for you? For me, it's a BMI of 35. You want to have a BMI of 35 or less. Aisha is asking, can you have a tummy tuck if you've had a C-section? Yes, I've answered that question. Great questions. I've operated on patients who've had multiple C-sections before, and they have done extremely well. All right, Crystal Gore is asking, can someone with fibromyalgia have a tummy tuck? You can, but it definitely, you have to be aware that your fibromyalgia may not be improved, and you may still have some problems with the fibromyalgia. But yes, you can have a tummy tuck. Elisa Resendez, can an apple-shaped body get good results? Good question. It depends on how much of the excess tissues you have and what we look like and when we do the examination. But that's a very good question. So it all depends on what you're wanting to look like, what you consider good results, and what is realistic. But yes, short answers, apple-shaped bodies can get good results, but it's all within the limitations of your physical body as well, and what you want to have done. Very good question here. Jesse is saying, is the mommy makeover safe for patients with adrenal insufficiency? So with adrenal insufficiency, we definitely want to make sure that you're properly monitored. So you'll most likely, if you get any procedures, you'll probably get them done in a hospital-based setting, and you'll want to get appropriate monitoring after that. That would have to be with much teamwork, I guess. So It Girl University is saying Miami is, sorry, I gotta tell TikTok that we're still going. Okay, so It Girl University is saying Miami goes lower than that. Yeah, I'm sure they do. There's a lot of competition in Miami. There's a lot of people that die in Miami. There's a lot of people that do these procedures who are not qualified to do those. If you want to gamble with your life and feel that it's something that you want to do, by all means, go to Miami. My recommendation is do your research, find an appropriate physician that is qualified to do that, because a lot of the deaths that we read about in the news and also in our community come from Miami. So my recommendation is, if you're going to be looking at price and shop on pricing, that's probably not the safest. So please be safe. Do your research. Make sure that the facilities you go to are legitimate and qualified, and that the surgeons that are doing it are actually board certified plastic surgeons, not just somebody with a cosmetic degree. But again, it's your life. I'm not going to impose you to go specifically somewhere. You are free to choose where you want to go. My role here on this platform is to give you good information and help you make the right decisions for your transformations. We had plenty of patients who've come in who actually fly from Florida to come and get their surgeries here and have surgery with us. So by all means, be careful. That is my recommendation for you guys. Weight amount in pounds. So it's not so much the pounds, it's more like your BMI. So for example, if you're 5'2", your maximum weight would be 191 pounds. If you're 5'4", your maximum weight should be 204 pounds. Anything less than that will put you in a category that will be safe for me to proceed with surgery. Sharon Oliver Canty, I'm a type 2. What does my A1C have to be? Thanks. You're very welcome. For me, the A1C needs to be 7 or less, and we can move forward with surgery. I've operated on many, many patients who have type 2 diabetes, and once we get them to a hemoglobin A1C of 7 or less, they do extremely well and heal very well. And I've done all of these procedures with them: the Drainless Tummy Tuck, mommy makeovers, arm lift surgery, and they've done well. So it's probably a warning from somebody that didn't like the life. Okay, maybe. I don't know what. Yeah, I don't know why. But hey, so we've gotten extremely restricted now to a very short amount of people who can actually benefit from this information, when we had a much bigger audience. But it is what it is. So hopefully next time nobody's going to complain because I really don't understand how any of this is inappropriate. This is very valuable information from a board certified plastic surgeon for people who actually want to have surgery. And so sometimes I just don't understand what TikTok is doing. I know they're not monitoring this with a human being. Otherwise they would be like, this complaint doesn't make any sense. But regardless, I'm here for the few who are here and following. Caribbean Queen is saying, what about if you have high blood pressure? Yes. So if you have high blood pressure, we want that blood pressure to be appropriately managed. So it needs to be controlled. I've operated on patients who have medical problems, but those medical problems are medically optimized. So type 2 diabetes, we need to get your hemoglobin A1C 7 or less. High blood pressure, we need to make sure that your blood pressure is well controlled with blood pressure medication. Anemia, we need to increase your blood levels so that it is at a safe range. If you're anemic and severely anemic, we cannot proceed with surgery because it's putting you at risk. There's a lot of stuff that we can do to medically optimize you to get you ready for the surgery, and then we can move forward with surgery. Yeah. Say 21 and over. I'm not sure what that comment refers to. Let's see here. Interesting. 5 C-sections. Is it safe to get a tummy tuck? Yes, it is safe. I've operated on patients who've had multiple C-sections and they've done fine. Like I said, they have. Okay. So Pretty Girl saying, start your live over. I guess I could probably do that. And then That's true. If they start restricting, I could probably just start the live over. Okay, so Sharon Oliver Canty is asking, what should the A1C be? It should be 7 or less for me to be able to get that. Let's see. So It Girl University was asking, why is Miami BMI lower than what you accept? Everybody, so okay, so for medicine and plastic surgery, there are multiple ways that we can actually treat somebody, right? There are certain guidelines to patient safety. Miami is a place where it's kind of like the wild, wild west. People do stuff without following guidelines. There's a lot of deaths. There's a lot of complications. A lot of people who, have a lot of problems because everybody is trying to do plastic surgery and they're not plastic surgeons. So that is very unsafe. So the state tries to impose limitations to help make it safer, but it doesn't necessarily make it safer because people don't follow those guidelines. So that's probably why the Miami BMI is lower. That's also why in Miami, they're restricted in the amount of fluid and fat that they can remove when they do liposuction because of all the deaths and complications that they've had. So it's very region specific. Houston, we have very good plastic surgeons here. We can do these procedures with not as many complications as they do in Miami. So, like I said, please do your research. Price should not be your North Star to find a plastic surgeon to do your plastic surgery. Do not gamble with your life. Find somebody who is qualified, save up to get your surgery done, and get it done. Okay, let's see here. What is the cost? How is that? A lot of these questions are coming back up. This is interesting. I wonder why. TikTok seems to be having some issues here. All right, so we're going to be coming up on, actually, we're already past an hour. Wonderful. I usually do this live for about an hour, and I really appreciate you guys participating and asking all these questions. I hope you found this helpful. And like I said, if I can leave you with anything tonight, is please, 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 please be safe. These are elective procedures. It is not emergency surgery. It is not something that you cannot physiologically live without. These are elective surgeries. That's why a lot of these procedures are not actually covered by insurance. And so please do your research. Take the time. I've had some people who've come in to see me and they canceled their surgeries because they had been going to, some other facilities in different cities, in Miami, even here in Houston. There are certain facilities that I wouldn't recommend at all. If you're not going to meet with the plastic surgeon who's going to be operating on you at least once or twice before the day of surgery, that could be a red flag. You have to make them at least once. One, you need to make sure that you like the surgeon, that you are comfortable with them. They're going to be operating on you and that they're going to be doing your surgery. If you go to a place where you have a lot of assistants and aides, that's where a lot of complications can come. So please, safety is extremely important. That is the message I guess I will take from some of these questions that I've gotten tonight. And I definitely wish you well. KLove24 is saying, how long does it take for a seroma to go away? You need to get it drained. So definitely follow up with a surgeon that operated on you if you have a seroma. If you catch it quickly enough and you drain it appropriately, you'll have multiple sessions where you come in to get it drained. It could last anywhere between 1 and 2 weeks. Everybody's different. Now, if that seroma has formed a capsule where it's got scar tissue on it, that fluid is going to continue to come up, and you'll have to actually get a revision to remove that excess scar tissue that kind of like formed a ball, so that you can actually remove that seroma permanently. All right, so let's see here. Let's see, one last question. Let's see, okay, he answered us. Okay, wonderful. Finally. I'm glad I answered your question. Sorry, there's a lot of questions here, and it seems to be like repeating itself. So I'm trying to go through all of this. And I keep going down and I see the same questions as well. So I apologize, but I appreciate you guys being patient. I'm going to take one more question. Thank you so much for following us. And definitely come and see us for your consultations and your surgeries, and we'll take care of that. Okay, so Resilient 57. I know you've been following us and asking some great questions for the past couple of weeks or months. The area you closed during Drainless Tummy Tuck, why is it left open in the first place? That is how everybody is trained. So this area is left open. So in other words, when I say it's left open, it's like your skin and fat are here. That's what we dissect here. So we make the incision here. We dissect all the way up to your rib cage. We lift this up. So we lift the skin off of your muscle. We pull the skin down. So you pull this down and then you cut the excess. That's how you do the tummy tuck. And then you kind of just put it back down. But the traditional way is you suture right here. This is where you close it, and you close it at the belly button. So all of this space here where we lift it, it's open in the sense that it's right here, and fluid can accumulate between these two layers. When I do my Drainless Tummy Tuck, I actually put stitches, so I close it down. That's what I mean. So it's not like you're gonna be walking around with your muscles being seen. No, you're gonna walk around like this, but underneath your skin in the traditional technique, you have two drains usually coming through here in that open space. And it's meant to draw out that fluid, which naturally occurs when you do that. But when you do the drainless technique that I do, there's no more space for that fluid to accumulate. So it really reduces your healing time, minimizes your swelling, and whatever little bit of fluid is there, your body is actually able to reabsorb it naturally, and then you heal much faster. I hope that answers your questions. Thank you very much, everybody, for participating. I appreciate your patience with me. And I like that recommendation of if anybody sends something that restricts the reach, I'll just restart the live. Hopefully you guys will be able to find us if I do restart the live. But tonight we're done. Have a good night. Have a great weekend, everybody. Until next time, Tuesday. And also look forward to seeing you guys in person or virtually for your consultations. Thank you very much, and God bless you. Bye-bye. All right. Thank you guys for joining us. I didn't see any questions on Instagram. The majority of my questions were coming from TikTok, so I was answering those, and hopefully you guys got some good insights from this. I wish you well. Have a good night, okay? Bye-bye. Okay. YouTube. All right. We are done with the live.